Hi, I'm Dr. Trudy Goers, and today we're talking about surgery for the thyroid gland. People will usually require surgery for their thyroids for a few different reasons. Number one is cancer. Papillary or medullary thyroid cancer is what we often see. People will also have simple benign overgrowth or nodules of their thyroid that are consistent with what's called a goiter. Sometimes this can be due to genetics, and sometimes this can be something that happens sporadically. If you have been diagnosed with a goiter, usually an ultrasound has been performed. An ultrasound is something that is not done under any sedation. It's done usually by a radiologist or an endocrinologist or possibly a surgeon, and this will actually identify the anatomy of your thyroid and where the concerning nodules are. When you've had a concerning nodule, a type of biopsy called an FNA or a fine needle aspiration also can be done under ultrasound guidance. Again, this will help determine if we're talking about surgery for a cancer or simply surgery because you're having symptoms due to overgrowth of your thyroid gland. These symptoms can include difficulty swallowing, difficulty breathing, pain in your neck, or simple cosmetic issues because you have a large growth in your neck. Lab studies that can be performed to help elucidate why you're having difficulty with your thyroid include your TSH, or your thyroid stimulating hormone, or actually your thyroid hormones, your free T4 and T3 levels. People who have overactive thyroids will usually have this problem treated with medications. However, if medications fail, this is also an indication again for surgical removal of the thyroid. Your thyroid is a butterfly-shaped gland that is actually located right over the top of your windpipe. You can see that there are many important structures located within the neck that surround the thyroid, and these are structures that we have to be careful of during surgery. Your incision is usually approximately 5 centimeters, and we try to bury this within an acceptable skin crease on your neck to have good cosmetic result. Once we actually have made our incision, the skin is quite pliable and we can actually get even large glands out through a small incision. The concerning structures within the neck when we're taking out a thyroid include your carotid artery, your jugular vein, and these small yellow lines that are seen here, which are the nerves to your voice box. We have to gently disconnect the thyroid gland from its blood supply also, which is shared with the parathyroid glands. The parathyroid glands are important in that they keep the level of your calcium even within your bloodstream. And there are 4 of them, as you can see here on this illustration, that we have to be aware of. Once we're able to disconnect the blood supply to your parathyroid glands and your thyroid, we gently peel the thyroid away from the other structures in the neck to remove it. You will stay overnight in the hospital for 1 night if your entire thyroid gland is removed. And this is because we need to check your calcium levels to make sure that your parathyroid glands are functioning appropriately. We want to make sure that you're able to swallow food without getting sick to your stomach or having anything stick. And we want to make sure that your voice is strong. On the first postoperative day after surgery, if you're tolerating a diet, your pain is controlled, and your calcium levels are normal, we will usually discharge you home with 2 different prescriptions. One is for your thyroid replacement medication, which will start on the first postoperative day, and we will send you home with some pain medications. If your calcium levels are somewhat low, we'll advise you to take Tums or calcium supplementation for the few weeks after surgery. After your thyroid is removed and you're at home, we actually ask that you stay on a soft diet. The other requirement is that, again, driving and lifting very heavy objects can be very difficult on your neck and the small blood vessels that we've disconnected from your thyroid. When we see you back in the office at 2 weeks, we'll be checking your calcium levels to make sure that they're normal. At 1 month after surgery, we'll be checking your thyroid levels to make sure that we have you on the correct dose of levothyroxine or Synthroid. This is something that usually will be a lifelong medication that is managed by your primary care doctor or possibly an endocrinologist. Life can get back to normal after your thyroid removal, but we do want to have you on the correct dose of your thyroid medication. And again, this medication is basically replacing the entire function of your thyroid gland that was removed. If you have had your thyroid removed for cancer, the postoperative chemotherapy for thyroid cancer will be discussed with you by an endocrinologist or an oncologist.